Okay, so this one is going to be kind of focusing on the dynamic of that upward and downward rotation of the scapula, the shoulder blade, as it moves with your arm. This is known as shoulder from the humerus, moving on the scapula there. This is shoulder abduction out to the side and adduction coming in. So just a few key pieces to the anatomy there. The upper trapezius muscle is going to fire and shorten with upward rotation, and then the levator, which you probably can't see very well here, going that way, is going to lengthen. And then in the reverse, the levator is going to shorten along with the rhomboid muscles, which are back here. And so those muscles are retractors, just as the middle trapezius is a retractor. So it gets a little confusing because you have multiple muscles doing the same thing, but also having key differences. So generally the middle and upper trapezius and even the lower trap as well are going to work in this direction of upward rotation, while the rhomboids and the levator are going to work in downward rotation. So it's key that if you're having issues or pain or difficulty, weakness or tightness restricting you with this upward rotation kind of motion here, which you may not recognize to be a restriction of upward rotation, you may just feel pain or pinching in the shoulder. Just key to understand the dynamic of what's going on there, because oftentimes the tightness and restriction of those other muscles is really causing a lot of the stress, strain, and pinching here. So we want to try to redirect that flow where it's at down in the back on the inside of the shoulder blade, so that the arm and the outside of the shoulder blade can come up here. So we really want to reinforce that. Now there's other muscles here deep in the armpit area between the shoulder blade and the ribs, is that the subscapularis muscle, and then out here a little further we have the teres major, and then your lat comes in through there as well, kind of like a flying squirrel, like the wing or the flap of skin that comes out there. So all that can restrict this motion of coming up here, where it's really up to the trapezius muscles to pull the shoulder blade back and then pull it up. The pectoral is also a major contributor to tightness and limitation, and pain, potentially pain pinching in here. Okay, so that's kind of the anatomy and informational portion, and then I'm going to make a separate video here that's going to be the actual exercise portion.